Like 2022, 2023 has been a year of transition, with the most violent phase of the pandemic behind us and focusing both on general pharmaceutical policy matters like medicine shortages and pricing and preparing the response for the next pandemic, while assessing governments and official institutions' roles in dealing with COVID-19. A year where EU and Dutch discussions overlap with global conversations, and we stepped up our outreach and advocacy efforts to engage new constituencies and partners. We have combined the production of high-quality, evidence-based advocacy products on AMR and diagnostics, IP and access to health technologies, and public return on public investment, with a robust outreach and advocacy effort in Brussels, The Hague, and Geneva. HI was also active at WHO. For the 76th World Health Assembly, we delivered statements on pandemic preparedness and universal health coverage, and we organized a joint public stand with Public Eye. We also created the coordination mechanisms for CSOs attending WHO governing bodies that is being used to align messaging in discussions at EMB and the Working Group on International Health Regulations, which we have been attending and contributing. At EU institutions, we have continued our contacts with the EU Council, European Commission and European Parliament, especially around the revision of the pharma legislation, responding to consultations and supporting amendments, and medicine shortages, providing testimony at the Health Committee in October. I is very much about civil society strengthening. This year, we engaged with the UNITAID NGO delegation to the retreat in Amsterdam back in January, and helped organize their visit to EU institutions in Brussels in February, while collaborating with them in bringing a CSO perspective to the Global Local Production Forum in November. We continue to coordinate a loose group of NGOs who had supported the TRIPS waiver back in 2021, now more focused on the general conversation on IP and access to health technologies at EU level, following deliberations of the COVID report and keeping track of the European Commission position on the discussions at WTO about the extension of the TRIPS decision from the 2022 Ministerial Conference. On this issue, we provided testimony to the US International Trade Commission in March. We remain committed to collaborating with other coalitions like the European Alliance for Affordable Medicines, the Dutch Medicine Network, and since April, with the Dutch Global Health Alliance.
Within the AI and Medicines project, we have been working throughout the year to influence tech policy at the EU level, at the European Medicines Agency, and we have also continued to grow our network and our collaborations with civil society. Most of our work has gone into the AI Act negotiations, where we drew attention to the need to protect health in the AI Act, and also the importance of this horizontal piece of legislation for the health sector. We've spoken to MEPs, negotiators and other NGOs to get health AI well regulated. And now the negotiations have come to a close, and we know that medical devices are regulated as high risk, and it remains to be seen how many other health AI systems are regulated. For the EMA, we followed the work of the EMA-HMA Big Data Steering Group, which is a group that works on big data and new technologies that are being used or can be used in medicines development and regulation. We have attended several meetings and responded to public consultations, for example, about the use of AI in medicines regulation. Early in the year, we have led a thematic network on AI and health inequalities for the EU Health Policy Platform, together with Brunel University's Center for AI. And we have delivered a joint statement to the European Commission, which received endorsements from about 30 civil society organizations. Following this, we have started collaborating more closely with CSOs and academics that work at the intersection of tech policy and healthcare. So we've convened an informal network of organizations which now meet regularly to exchange and coordinate. And to support all of our advocacy efforts across all our streams of work, we've developed reports, fact sheets, briefs, voting advice, and an animation video. We're looking forward to continue our advocacy work over 2024 and keep on calling for patient-centric and responsible use of algorithmic technologies in healthcare.